Okay, well, good morning and good afternoon, everyone. I'm Elizabeth Landine. I'm the Assistant Manager of Program and Partnership Development with the National Environmental Health Association. Thank you for joining us today for the National Environmental Assessment Reporting System, otherwise known as NEARS, webinar. NEHA has partnered with CDC's Environmental Health Services branch to prevent foodborne illness outbreaks by helping to promote the value of NEARS and its benefits to food safety programs. So during this webinar, you will be provided with a brief overview and background about NEARS, followed by success stories from 2 of the 23 agencies currently participating in NEARS, those being the New York City Department of Health and Mental Hygiene and the Tennessee Department of Health. The goal of this webinar today is to provide information about how NEARS can assist your food safety program in preventing foodborne illness outbreaks in your jurisdiction by identifying and understanding environmental factors. All webinar participants will be in listen-only mode. This webinar is being recorded. If you are uncomfortable with that or not okay with that, you can disconnect at this time. Also, there will be a Q&A at the end of the presentation. So we will hold all questions until the end. A Q&A will be conducted via the webinar chat box in the corner of your screen. So feel free to enter in any questions you have via the chat box throughout the webinar, and we'll address the questions at the end of the presentation. So we have a great lineup of speakers today, and to ensure we have enough time at the end of the webinar to take your questions, we'll go ahead and get started. Our first speaker today is Eric Coleman. Eric is a health scientist with the Centers for Disease Control and Prevention at the National Center for Environmental Health. Currently, Eric supports NEARS as well as the e-learning on environmental assessment of foodborne illness outbreaks and other related activities that aid in understanding and preventing environmental causes of foodborne illness outbreaks. At this point, I'll go ahead and turn it over to you, Eric.
Thank you. And thank you to everyone that's joining us today. Today's presentation and webinar will improve your competency on conducting environmental assessments as part of a foodborne illness outbreak investigation, and also encourage your participation within NEARS, or the National Environmental Assessment Reporting System. All right, so as I'm sure most of you are aware, foodborne illness is a significant problem here in the United States, but addressing environmental causes can help prevent it. Foodborne illness outbreaks are often reported to CDC's National Outbreak Reporting System, or NEARS. However, those outbreaks that are reported into NEARS often include little or no information about the environmental causes of foodborne illness outbreaks. NEARS serves as a companion surveillance system to NEARS for the reporting of environmental assessment data. Again, NEARS captures environmental factors or data on environmental factors, and it provides information that is needed to recommend effective short-term and long-term interventions to stop ongoing foodborne illness outbreaks and prevent them from happening in the future. And this system is typically reported into by state and local environmental health specialists. Now, historically, CDC has collected the epi and the lab component of foodborne illness outbreaks, but lacked the environmental component of outbreaks. NEARS collects environmental assessment data and again helps us understand how and why outbreaks occur. Typically conducted by your environmental health specialist, the foodborne outbreak environmental assessment is actually very different from other types of environmental activities that food programs conduct on a daily basis. The challenge of a foodborne outbreak environmental assessment is the reconstruction of past events, which help to describe how the environment contributes to the production and or transmission of agents that cause illness. And even more challenging is the fact that these assessments represent one component of a response that involves not only food programs, but often epidemiologists, laboratorians, and possibly others from other program areas, who are all essentially working as a team to identify contributing factors, identify their environmental antecedents, and then generate recommendations for informed interventions. Now I'd like to take a moment just to kind of expand a little bit more about the contributing factors and environmental antecedents. Contributing factors are determinants that directly or indirectly cause an outbreak, and they describe how the outbreak occurred. They are categorized as contamination factors, proliferation factors, and survival factors. Now, your environmental antecedents or root causes are factors that lead to the contributing factors and describe why the outbreak occurred. And based on our work here at CDC, we have identified categories of potential antecedents, and they are people, process, economics, equipment, and food. So to kind of put this all into context, this slide here outlines an outbreak where the identified pathogen was norovirus. The outbreak was caused by coleslaw eaten at a restaurant. And the contributing factors of what happened to cause the outbreak was due to a worker not washing his or her hands after using the restroom. That worker then went on to prepare coleslaw using his or her bare hands. And then also that worker came to work that day sick. Now the environmental antecedents which led to the contributing factors are due to the establishment not properly equipping its hand sinks with soap. The worker also lacked training on proper hand washing, and then the establishment did not provide paid sick leave to its employees. Now, we can't overstate the value of reporting environmental assessment data. Again, these data are key to truly understanding how and why outbreaks occur, and they assist with developing and improving guidelines, policies, and practices related to food safety, and then ultimately preventing foodborne illness outbreaks. Additionally, this provides opportunities for us to engage our food safety officials who are responsible for conducting environmental assessments. And then when environmental assessment data is reported, although right now it's reported on a limited basis, it provides us an opportunity to link data across systems so that we can potentially connect the epi-lab and environmental components of a foodborne illness outbreak and strengthen the robustness of outbreak data that's reported to CDC. Now to date, we have a total of 23 state and local agencies that are registered to begin reporting their environmental assessment data to NEARS. And over time, we'd like to see these numbers increase. Back in 2014, CDC began a formal evaluation of NEARS, and the evaluation was conducted to determine the effectiveness of NEARS. And findings from this evaluation help inform things like why programs registered. So if your program is interested in things like receiving training on conducting environmental assessments or standardizing outbreak response within your respective jurisdictions or responding to outbreaks more quickly, we truly encourage you to consider NEARS participation. Now, before I close, I'd like to touch on a few outcomes and benefits to programs. And I think this may be of some interest to some, right? Now, it's important to remember that NEARS is a system, and by nature, surveillance systems are not designed to provide immediate benefits to participants unless they're being paid, of course. They're designed to provide benefits over long term, so we like to think of NEARS as somewhat of a long-term investment into the improvement of food safety. But here are some thoughts on more immediate benefits. So as I mentioned before, environmental assessment data is not frequently reported, so you'll be assisting in increasing the reporting of environmental assessment data. You'll also have access to practical information on conducting environmental assessments, like the NEARS manual and our data reporting instrument that can be used as a guide to conduct environmental assessments. And then additionally, we have a free online environmental assessment training that's available to anyone that's interested in taking it that assists improving competency for conducting environmental assessments as a part of a foodborne illness outbreak investigation. Additionally, participants will have access to a free data entry and storage system for entering all of your environmental assessment data. And as we begin to think long-term, the data that's captured within NEARS will help us better understand what environmental assessments are associated with outbreak occurrences, what environmental antecedents are associated with outbreak types or specific pathogens. You'll be able to identify what environmental antecedents are associated with specific contributing factor categories or specific contributing factors. And some additional benefits specifically to NEARS participants. Each year we provide annual reports. So we generate two. One which consists of a comprehensive document that summarizes all of the outbreak data that's been reported from all of our sites. And then we provide a individualized special report specific to your jurisdiction and the data that you've entered into the system that year. And it's also important to note that for sites that are interested in FDA's Retail Food Regulatory Program standards, specifically Standard 5, these reports help complement some of the requirements in meeting Standard 5 for those that are interested. Additionally, our NEARS participants have an opportunity to collaborate and communicate with other sites that are participating in NEARS. On a quarterly basis, we get together and have a call where we talk about any existing challenges or things that are actually happening in the field that are related to conducting environmental assessments and things that we can work on and improve to strengthen the process. Additionally, you'll have an opportunity to document and track foodborne outbreak response. Of course, you'll have opportunities for scientific publications. And as I mentioned before, for those that are interested in meeting Standard 5 requirements, our annual reports that are generated assist with complementing some of the requirements within this specific standard. Now, in more of a broad context or big picture, the data that is reported to NEARS we envision will ultimately strengthen the national description of foodborne illness outbreak data, prevent illnesses and deaths, also assist with mitigating social and economic disruptions along the food production and manufacturing. And then, of course, there's obvious cost savings to preventing outbreaks and understanding their environmental causes. So in closing, I ask that you join us in the effort to reduce and prevent foodborne illness outbreaks by participating in NEARS. And this can be accomplished by essentially committing to conducting environmental assessments as part of a foodborne illness outbreak investigation, completing our NEARS registration forms, which are available on our website. And then if you are conducting environmental assessments and or reporting environmental assessment data to NEARS, we strongly encourage you to complete our free online environmental assessment training, which again assists in improving competency for conducting environmental assessments. So let's work together to improve food safety. Thank you.
Great, thank you, Eric. Our next speaker is Dan O'Halloran. Dan is the NEARS coordinator with the New York City Department of Health and Mental Hygiene. Dan received his master's in public health from New York University in spring of 2016. He started in his role as NEARS coordinator in February of 2016. He splits his time between the Office of Environmental Investigations, where he responds to public complaints of foodborne illness and conducts traceback investigations, and the Bureau of Environmental Surveillance and Policy, where he documents NEARS data gathered in the field and assists with other SNET projects. Dan has helped to bridge the communication gap between offices and ensure that environmental assessments are conducted at every foodborne illness investigation. Dan, I'll go ahead and turn it over to you at this point.
Great. Thanks, Elizabeth, for the introduction. Hi, everybody. Today I'm going to present how we use NEARS to identify environmental antecedents in foodborne illness outbreaks in New York City. New York City began collecting NEARS data in 2012. And we've been increasing our environmental assessment coverage on reported foodborne illness outbreaks that occur in restaurants every year since. In this presentation, I'm going to walk you through what our investigation process looks like, the main groups involved, everyone's roles and responsibilities, and our experience with collecting NEARS data. So before we get into our investigation process, I just want to give you a quick background on the food environment in New York City because it's quite an interesting landscape. New York City has approximately 24,000 restaurants located throughout the 5 boroughs: the Bronx, Brooklyn, Manhattan, Queens, and Staten Island. New Yorkers eat out nearly 1 billion times per year, which translates to a lot of people at risk of becoming ill. With that in mind, the health department receives over 3,000 complaints of foodborne illness every year from various sources. The number varies greatly, but generally we see about 20 to 30 restaurant-related outbreaks that are identified each year. Foodborne illness outbreak investigations in New York City require collaboration across bureaus. On this slide, you will see all the groups involved with the outbreak investigation process. First, we have the Office of Environmental Investigations, also known as OEI. This is the main hub where foodborne illness complaints from the public are received and verified. OEI responds to all foodborne illness complaints involving restaurants, schools, supermarkets, nursing homes, and mental health facilities in New York City. OEI houses the Chief of Food Poisoning along with 8 field investigators that investigate and collect environmental assessment data in food service establishments that are suspected to have a foodborne illness outbreak. OEI is responsible for completing the entire investigation process with outbreaks of less than 10 people. Next, we have the Bureau of Communicable Disease, also known as BCD. With a much larger staff capacity, BCD takes over suspected foodborne illness outbreaks that involve 10 or more people. They draft questionnaires based on suspected food items that were consumed and attempt to interview all persons, both ill and well, that attended the suspected event. They also attempt to obtain lists of other group reservations that attended the establishment during the same time frame to see if there are additional ill patrons that did not report their illnesses. BCD also performs the epidemiological analysis for every confirmed outbreak and every outbreak investigation that involves 10 or more people. Finally, we have the Public Health Laboratory, or PHL. All of the clinical and food samples that we collect or distribute in the field are analyzed by the lab, and we usually receive the results within a week. Now, the rest of this presentation will focus only on outbreaks that occur in restaurants in New York City. Here, you'll see what our outbreak investigation process looks like from beginning to end. First, we verify the complaints that are received from the public. Most of our complaints of foodborne illness come from 311, which is the information line that we have here in New York City. We also monitor social media sites like Yelp and Twitter for complaints of illness, and some positive cases are reported to us by doctors, hospitals, and clinics. Once a complaint is verified, we begin our investigation process, usually starting with an interview over the phone or via email to obtain a 3-day food history and symptomatology of all attendees, both ill and well, of the suspected event. We will also inform BCD of the potential outbreak at this point if the outbreak contains 10 or more people, so they can create an interview questionnaire and begin the epidemiological analysis with all the evidence gathered during interviews. Next, if we believe there's enough evidence to warrant an inspection, we will send an OEI investigator to the suspected retail establishment to perform an initial field visit and look for public health hazards. This is when the environmental assessment is completed and the NEARS data is collected. Field investigators may also perform a HACCP if there is a suspected food item. They may collect food samples and distribute stool kits to be analyzed by the public health lab. Once all the data has been collected and there are no new reports of illnesses, and any samples that were collected have been analyzed, we try our best to identify the cause of illness, and then the investigation can be closed. Finally, we review the case and all of the data that was collected and communicate with the NEARS administrator for New York State to make sure all of our data is in sync. And as Eric already explained, NEARS is the National Outbreak Reporting System. Then we submit our NEARS data to CDC through the Environmental Health Specialist Network website. We identify approximately 20 to 30 foodborne illness outbreaks in New York City restaurants each year. And now I'm going to present some of the outbreak data that we've collected over the past few years. In this first table, data that we've collected on suspected or confirmed pathogens associated with each foodborne illness outbreak from 2013 to 2015. It is important to note that these numbers represent number of outbreaks, not the number of cases associated with each outbreak. The most common identified agents that we see in foodborne outbreaks each year include Campylobacter, norovirus, salmonella, and scombroid toxin. One of the benefits of collecting NEARS data is that you can start to see trends in the data over time for your jurisdiction. These trends can help to inform policies, interventions, or outreach materials that you may develop to educate the public or restaurant operators in your area. This table clearly illustrates that norovirus is the most common pathogen identified that we see every year. The next figure is showing some of the data that we've collected on suspected food vehicles from 2013 to 2015 in outbreaks that occurred in New York City restaurants. You can see that a large portion of our outbreaks have undetermined food vehicles. But some of the other common food vehicles that we are seeing include fish, meat, and poultry. These data trends provide more opportunity for policymaking, education, and outreach. One example of this is developing resources for restaurant operators to understand which foods present the highest risk. This last figure is showing how our environmental assessment data collection coverage has increased every year since NEARS was first implemented in New York City in 2012. Prior to the integration of NEARS, sanitarians were aware that environmental antecedents were important, and they were collecting the data, but they did not track them systematically. As you can see from this graph, we've increased our coverage of environmental assessments from just over 15% of reported outbreaks when NEARS was first launched in 2012 to over 85% in 2015. 2016 data is not finalized yet, but preliminary results suggest that our coverage was over 90%, and we're hoping for 100% coverage in 2017. On the next slide, you will see a table for one of our projects that is in development, a foodborne illness outbreak annual report that is specific to New York City. We are using a combination of NEARS, NORS, and complaint data to develop an annual report. Some of the tables that we are developing include complaints received by source, food worker testing, food service establishment demographics, agents identified, contributing factors, and environmental antecedents identified during investigations. Although it takes a while to accumulate a critical mass of data to be able to describe patterns, as Eric mentioned, the CDC develops national summary reports of NEARS data annually and also develops summary reports for each jurisdiction, even if your number of reported outbreaks is low. Here, you'll see a table with some of the environmental antecedents that are identified during the course of an outbreak investigation. This comprehensive list was adapted from the CDC e-learning course on foodborne illness outbreak environmental assessment. On the left-hand side, you'll see the internal system variables, and on the right-hand side, you will see the environmental antecedents associated with each variable. Most of these environmental antecedents are extracted from the manager interview and establishment observation, which is part 3 and 4 of the NEARS manual. For example, if one of the contributing factors identified during the course of the investigation was bare hand contact by an ill food handler, an associated environmental antecedent could potentially have been any of the following: blocked hand wash sinks, inadequate supplies for hand wash sinks, lack of training, inadequate supervision, inadequate supply of gloves, and so on. Next, I'd like to share some of our success stories that have emerged from our integration of NEARS data collection. First and foremost, identifying trends in the data. Just like with any good surveillance system, collecting standardized environmental assessment data over time has led to the identification of trends in foodborne illness outbreaks in New York City. In addition to the data that I shared with you on previous slides, we are working towards describing the most common characteristics of foodborne illness outbreaks in New York City over time. Identifying trends in the data is essential for developing policies, interventions, and outreach or educational materials to prevent future outbreaks. We've also developed a one-page data collection tool for our investigators to easily record environmental assessment data while in the field. This tool has been essential for gaining buy-in with our inspectors, as it does not add too much work to their plate. Just this past year, NEARS data collection was adopted by the Office of Environmental Investigations into their standard operating procedure, ensuring that environmental assessment data will be collected at every suspected foodborne illness outbreak going forward. And finally, identifying environmental antecedents in foodborne illness outbreaks encourages state and local jurisdictions to be proactive rather than reactive. This will help to prevent future outbreaks, which is always the goal of public health. Here, you'll see what our one-page field observation form looks like. This data collection tool condenses all of the questions from the Establishment Observation section in Section 4 of the NEARS Data Entry Manual into a convenient one-page form. If anyone would like me to share this data collection tool with your jurisdiction, just let me know and I can email you a copy. And that's a wrap. Thanks for listening. I also just want to take a moment to thank the Environmental Health Specialist Network for supporting our work.
Wonderful. Thank you, Dan. Great presentation. So our next and final speaker today is Danny Ripley. Danny is an environmental health specialist with the Nashville Metro Public Health Department since 2003. His primary job responsibilities include environmental lead for all foodborne outbreak investigations in Nashville-Davidson County, participation in state-specific and multi-state environmental health specialist network, or SNET projects, providing epi-ready foodborne outbreak training to health departments across the Southeast United States, and enforcing food regulations at retail and food service within Nashville-Davidson County. At this point, I'll go ahead and turn it over to you, Danny.
Thank you, Elizabeth, and I want to thank everyone for remaining on the call for the third and final presentation. What I'm going to talk to you about today is Tennessee and how Tennessee has involved NEARS in the outbreak investigation process. Before I get started, I will tell you that Tennessee has been involved with NEARS since its inception. Tennessee's been involved as an SNET state since 2000. If we look at I should be able to. Sorry, I'm having a little bit of.
Is it not advancing, Danny?
It's not advancing.
All right. Do you want to just tell me next? Oh, there you go.
Okay, there we go. Okay, so if we look at Tennessee, we have 95 counties in Tennessee. We have 7 regions. Within the state, we have 5 contract counties, Nashville-Davidson County being one of those contract counties, as you might predict, the other contract counties being the metropolitan cities, Memphis, Chattanooga, Knoxville, and Jackson, Tennessee. Throughout the state, we have 169 environmental health specialists. Our food regulations here in Tennessee are centralized, meaning they're developed by the Tennessee Department of Health for the food service environments, and they're based off the 2009 FDA Food Code. Tennessee has a population of approximately 63 million people, and we have approximately 28,000 food establishments throughout Tennessee serving those 63 million and those who come and go throughout Tennessee. If we look at our outbreak procedures, they're really no different than most states across the United States, in that we have an investigation team comprised of core members being environmental health, epidemiology, and laboratory folks. We've identified those that some opportunities in the success or factors that would influence the success of an investigation. And again, these are not uncommon to outbreak teams and outbreak investigations across the country. And those things include the amount of data or the data quality we get during outbreak investigations, of course, communications during outbreak investigations, and then also individual abilities, and in particular, our environmental health specialists' abilities to conduct effective environmental assessments during outbreak investigations. Clearly, our environmental health specialists across the state have a command of the food code and have a good understanding of routine regulatory work. But as we know, routine regulatory work and environmental assessments are two entirely different things typically, and require a different skill set and a different knowledge to conduct outbreak investigations and environmental assessments effectively. So throughout Tennessee, I've pulled the most recent year's data of foodborne outbreaks. We have 18 outbreaks reported through the various areas. And you can see here we have some regions that didn't or had no identified foodborne outbreaks. So one of the challenges with the 159 environmental health specialists across the state is the experience in outbreak investigations. Many of these folks may not be involved in outbreak investigations, or it may be some time before they're actually involved in outbreak investigations. One way to combat this without training every single environmental health specialist across the state in environmental assessments and outbreak investigations is to designate specific outbreak investigators. If we break the state down into 13 regions, each region has a primary contact. This primary contact is the person who would be responsible for conducting a foodborne outbreak investigation, the environmental component of the investigation, I should say. They're also responsible for the NEARS data collection and data entry. Most of these regions also have secondary contacts. This is an individual who's also trained to conduct the environmental assessments as well as collect NEARS data. And then finally, we have field environmental health specialists in some of the various regions throughout the state. So these folks typically are senior staff, and they have, most all of them have participated in EpiReady training that we've conducted across the state, as well as face-to-face NEARS training. Most of them have completed the e-learning training that Eric mentioned earlier, the web-based training. And I think one unique situation we have here in Tennessee is that we have the opportunity to provide support through our SNET staff at Central Office for each and every outbreak. That support can extend to the collection of data, of the NEARS data, and the entry of that data. As I mentioned earlier, and I'm sure many on the call can attest to, when we have infrequency in outbreak investigation, sometimes we get a little bit rusty on what we need to do and what forms we need to get, and this support role can help alleviate some of those challenges as these outbreaks occur. So we're very proud to have that opportunity to provide this level of support. So essentially that's how the NEARS is rolled out throughout Tennessee, and how the NEARS data is collected and the support roles involved. Now I'm going to shift over to Nashville-Davidson County. And Nashville-Davidson County, as I mentioned earlier, is a contract county. It's a local government. We're under contract with Tennessee Department of Health and Tennessee Department of Agriculture. We have jurisdiction over all food service establishments that serve food to the general public here in Metro Davidson County. We have 20 environmental health specialists, and we have approximately 5,000 food establishments throughout the county, and those include the typical restaurants, schools, mobiles, etc. I am the primary person who would be collecting NEARS data and reporting the data into the system. And if I do have a support person here, if I have a need for additional help, but certainly I'm just a short drive away from Central Office, so I have our SNET support there as well. So next I want to talk about how we use NEARS in an actual investigation. And this foodborne outbreak investigation occurred this year, so it's very recent. And the use of NEARS within this investigation actually helped us learn a little bit more than perhaps we might have ordinarily learned through a typical environmental assessment. Just a brief overview on the outbreak. We had 3 clinically confirmed cases. They were all confirmed Campylobacter jejuni, and we had 1 suspect. 1 food establishment in common, several common foods reported. As far as the lab epi-environmental going into the investigation, we knew the etiology. We had no food. The onset for Campylobacter is rather long, and with pathogen surveillance, we typically don't learn of these outbreaks for several days, if not weeks, after the fact. The epidemiology, we had very limited data for the epidemiology for any studies. There just wasn't available data at the facility in terms of additional cases. Our active case finding wasn't successful. So it leads us to the environmental, and we had, again, a significant gap between the incident and notification. Plus, we had several foods that were implicated, so we didn't have one specific food, although obviously we're focused on poultry products. So what we learned through the initial environmental assessment, the observation, going through looking at the situation that was occurring or had occurred in the establishment, we did find some subtle contamination factors. We found also some subtle proliferation factors. But the survival factors were very well under control. There wasn't any opportunity there. The problem was there were simply no glaring contributing factors observed during our observation. However, when we went through the manager interview, some of the questions and responses to some of the questions regarding policy and procedure, regarding training, prompted us after the interview to go back and follow up on some of the systems and processes that were involved in this establishment. And in doing so, we learned of an area where there was occasional raw, ready-to-eat commingling of a prep table. And there was a lack of understanding proper cleaning and sanitizing, and a lack of general training. There was also language barriers that likely contributed to these issues. So it prompted us to, again, go back and look at things a little bit more carefully, and we were able to more confidently come up with a contributing factor that likely led to contamination of foods. So I'm going to finish by answering the question in terms of why we participate in NEARS. What is in it for us? And of course, as I mentioned earlier, we're an SNAP funded state, so we're obligated to participate in NEARS to a degree. However, if we were not SNAP funded, there's still tremendous value to participating in NEARS. We believe that without question it improves our outbreak investigation. It improves our communication, the communication between environmentalists and epidemiologists. Often is the case when outbreaks occur and outbreak investigations occur, environmental assessments that take place, that information is fielded to the epidemiologists who often lead the investigation. But then there's really no further communication, or there may be a lack of communication after the fact. And when we're reporting contributing factors on NEARS reports, it's imperative that the environmental health specialists have input. Because if you looked at the information found on the report that was initially provided for the environmental assessment at this firm that we had this outbreak at, you would probably see a proliferation factor there and another contamination factor that frankly had little, if nothing, to do with the contamination of this food. So it's important that the communication occurs, and we feel like participation in NEARS facilitates that, simply because the environmental health specialists are also collecting and reporting the contributing factor data, and the opportunity to compare notes with the epidemiologist and the NEARS data is invaluable. We also believe that the communication also extends to the operator and the environmental health specialist. In many cases, understanding policies, procedures, systems within the firm can help us understand better what controls need to be implemented in any given outbreak. So we believe that there's a value there as well. And then the use of the data, and it's already been spoken, Eric spoke about the data, as well as Dan, and the usefulness of the data and looking at data across the entire state or locally, better understanding the contributing factors and antecedents within our own outbreaks. And as others have pointed out, this can help influence how we do our routine inspections, how we train our environmentalists, and also how we do outreach to the public in terms of training, food safety training. Provides documentation in terms of what we do. Tennessee is applying or is part of the FDA program standards, so it does facilitate Standard 5. And finally, it contributes to the nationwide research. As an entire country, the better we understand these environmental antecedents, the better we can make informed, educated decisions regarding policy procedure at the federal, at the state, and at the local level. And it allows us to do what we're all here to do, and that's promote public health. So that's the reasons we do NEARS, are the reasons we feel like NEARS is most valuable to our program. And with that, I'll end my talk and open it back up or turn it back over to Elizabeth.
Great. Thank you, Danny. That was really wonderful. And thanks to all our speakers today. We're going to take some Q&A here in a minute, but first just wanted to say it was a fantastic overview of what NEARS is and how it can benefit us on a national level, but also how it can benefit food safety programs at the local and state level in preventing foodborne illness outbreaks. I've put each of the speakers' contact information, their email addresses, into the chat box, so please do follow up with any of the speakers if you have questions you want to ask them or documents they shared that you'd like to have access to or anything like that. Feel free to reach out to them directly. So at this point, we'll move into the Q&A portion. We've got about 10 minutes. If you have questions, please do type them into the chat box. We've already received a few, so we'll do our best to answer all the questions in the time we have remaining. And any other questions you have, again, feel free to send those directly to me after the webinar if they come up afterwards. So let's see, questions. Maybe this one will be for Eric. Eric, what training is needed to participate in NEARS?
Yeah, that's a good question. So as I mentioned before, we highly recommend everyone take CDC's online environmental assessment training. We feel that that is a really good tool to provide an enhanced competency for conducting environmental assessments. It's available online. It's free to anyone that's interested in taking it. We also offer CEUs for those that are interested in receiving CEUs, but we really do feel like that provides really great foundational knowledge for conducting environmental assessments, and that's pretty much the primary training that we recommend folks having prior to participating in NEARS. Yeah.
Great. Thanks, Eric. And there was another question that came in over the chat box that Dan answered already, but it was asking how long New York City's been participating in NEARS, and Dan replied that they began reporting to NEARS in 2012, and before that it was previously known as NEVIS. So just wanted to share that with everyone. I think this one's for Danny. A question came in that said, what was considered inappropriate use of wiping towels?
Yes, that's a good question. During our initial observation, we observed folks that were using towels to wipe down smaller pieces of equipment that ordinarily we would require to be cleaned and sanitized in a different manner. So that was in violation of our code. But that particular practice had very little to do with any of the suspect foods. It did show there was a lack of understanding of the use of towels for cleaning and sanitizing in general, which could be, again, a training issue, certainly. But that's what it amounted to. I don't know. I hope that answered the question.
Thanks, Danny. We just got another question. So has anyone had any experience in using NEARS for outbreak investigations involving restaurants who received contaminated products from suppliers, i.e. how to incorporate data found at the manufacturing? Not sure who would like to take that or has experience with that.
I could just say, as far as New York City is concerned, the New York City Health Department only has jurisdictions in restaurants. So if that were the case, we would probably inspect the restaurant, perform a regular sanitary inspection, and do the environmental assessment at that point at the restaurant. And then our investigators, may obtain information from the manufacturer or supplier site. If that's in New York City, they might go to that site and do another inspection. But we wouldn't collect environmental assessment data at the manufacturing site because we don't have jurisdiction there.
And this is Danny. We do the exact same thing if we have a situation where we believe it's a source-related matter. We certainly forward that on to the appropriate regulatory agencies involved in either manufacturing or distribution. We would investigate the establishment to see if there were any opportunities for contribution to contamination, but certainly if it's a source-related issue, then appropriate other folks would be involved.
Great. And just for anyone who's not keeping an eye on the chat box, Dan did put a message in there that anyone that's interested in the one-page field observation document he had posted, if you're interested in that, to feel free to send him an email directly, and his email's in that chat box. So another question we have is, how time-intensive is it to get set up and comfortable with using the NEARS system? Not sure who would like to take that one.
I'll take that. So there is some initial training that's kind of required to participate in NEARS. We typically hold a brief webinar with folks just to kind of go through basic introductory information and orientation. And also kind of work through entering data into the system. And that's after you've kind of submitted your NEARS registration documentation. And I guess in between that time period, it would be, I guess, up to the respective jurisdiction to kind of work out how they envision, I guess, NEARS being implemented within their respective jurisdiction. I know certain jurisdictions operate a little differently than others, so we kind of really place much of the discretion on how you implement NEARS within your jurisdiction. We kind of leave that to you, to the respective jurisdiction. So I don't know if we have a specific time period on how you implement it within your respective jurisdiction, but there are, again, some initial webinars that we hold with new participants in the beginning, which are about an hour or so, and then thereafter, I think most of the implementation is kind of left to the respective state or local.
Got it. Thanks, Eric. Another question is, and this is probably for Dan, because Danny, you did touch on this in your presentation, but I'd be curious to hear from Dan on this. It says, once we do this work, entering this data into the system, what happens to it? Can you explain how the data will be shared or how it will influence or improve food safety specifically at the local level?
Well, one of the things that the CDC does is that they provide summary reports on an annual basis. So they summarize all the data that's submitted to NEARS for every jurisdiction on a national level, but they also produce summary reports for each jurisdiction locally. So, even if you have only a few reported outbreaks, you'll still get a summary report from the CDC specific to your jurisdiction. And I think Eric shared a slide with what those look like, but it should have some of the characteristics of the outbreaks that we're seeing. I believe it was slide 15. I don't know if we could go back to that.
I can, yeah. Hold on.
Okay, great. Maybe you want to pull that up and just show it. Yep, there it goes.
All
and
right.
they're also available on the CDC website for folks that are interested in kind of viewing those in greater detail.
Yeah, they're really great summary reports. They look really nice, and the information is presented well in them. And the CDC website is pulled up there for those that want to access that information. So any other questions, feel free to go ahead and type them into the chat box. I do have some people that were asking if they will have access to these slides, and we've recorded this webinar, so we'll have the webinar sent out to everybody afterwards. If you would like anyone's slides in particular, feel free to reach out to them, whether that's Eric or Dan or Danny. I don't think they're going to be posted on CDC's website per se, but you can certainly reach out to the speakers, and I'm sure they would be fine forwarding those to you. Okay, so we're coming up on the hour here, and I don't have any more questions. So I'd like to thank our speakers again and thank all of you for taking the time to join us today. Before you hang up, please be sure to fill out our webinar survey once you do disconnect, which also allows you an opportunity to put in your contact information if you're interested in receiving more information to be able to participate in NEARS. We'd also love to get your feedback on maybe what are some other webinars you would like to see NEHA conducting in the future. So please take a minute. It should only take a minute to fill out that survey. And again, you can feel free to reach out to me directly or to Eric Coleman at CDC. Our contact information, again, is in the chat box. So thank you again, everyone, for joining us today. Have a great day.